Hi, my name is Jennifer Stevens, and I am presenting on heart disease and prevention. The reason I decided to present on heart disease and prevention is the area that I researched, Sheffield in Ohio, is the #1 reported disease in this area. So a little bit about heart disease. It is the leading cause of death in the United States. 1 in 4 deaths are due to heart disease, which is about 600,000 people per year. Every minute someone in the United States dies from a heart-related event. 715,000 Americans have a heart attack every year. The most common form of heart disease is coronary artery disease, which limits the blood flow to the heart, and a complete blockage would cause a person to have a heart attack. Heart disease refers to several types of heart conditions. There are blood vessel diseases, narrowed or blocked blood vessels, coronary artery disease, heart rhythm problems or arrhythmias, heart defects, which can be or are congenital. Heart disease is also referred to, or you may hear it called, cardiovascular disease. And sometimes this disease is silent and not diagnosed until years after a person has the disease or a symptom occurs. These symptoms include heart attack, arrhythmia, and heart failure. When a person's having a heart attack, they may feel chest pain or discomfort, upper back pain or neck pain, indigestion, heartburn, nausea and vomiting, extreme fatigue or shortness of breath. A person having an arrhythmia may feel heart palpitations or a fluttering feeling in their chest. And a person experiencing heart failure may start to feel shortness of breath or fatigue or swelling of the legs, the feet, the ankles, and the neck veins. Some of the risk factors include non-modifiable and modifiable. Non-modifiable risk factors are risk factors that cannot be changed. So these include age, and the risk increases with age. So 85% of people who die of coronary artery disease are 65 years of age or older. Men are greater risk than women. The risk increases after menopause. There is a family history which increases the risk. So if your parents or siblings or children have the disease, the likelihood is higher. And certain races also increase the risk factors of heart disease, and these include African Americans, Mexican Americans, American Indians, Native Hawaiians, and Asian Americans. Modifiable risk factors are the risk factors that a person can change to decrease their risk of getting heart disease, or if they've already been diagnosed with heart disease, can reverse heart disease. These include smoking, high blood pressure, high blood cholesterol and high triglycerides, being overweight or obese, physical inactivity, diabetes, metabolic syndrome, stress, and birth control pills. Now, a person who has one or more risk factors do increase their risk of obtaining heart disease. So one risk factor, such as a smoker, doubles their risk of obtaining heart disease. 2 risk factors quadruples the risk, and a person with 3 or more risk factors increases the risk tenfold. So a patient who smokes, has high blood pressure, and is overweight increases their chance of getting heart disease tenfold, which is pretty high. There are ways to prevent getting heart disease or reversing heart disease. First and foremost is to stop smoking. More than twice as likely than non-smokers, smokers' chances of getting heart disease and having a heart attack are great. This includes cigarettes, pipes, cigarette smokers, vaping, and also e-cigarettes. Lowering total cholesterol the LDL cholesterol and triglycerides. So you can do this by avoiding trans fat or increasing your fiber intake. And to raise your good cholesterol, and this helps take away the bad cholesterol from your arteries. Also, preventing or reversing heart disease includes lowering your blood pressure. So if your blood pressure is over 120/80, you do need to take steps to lower this. And you can do this by controlling your diet, eating a low sodium diet, exercising, weight management, and medication if prescribed by your physician. The goal is to have a blood pressure that is less than 120/80. Also controlling diabetes, keeping your A1C below 6.5, non-diabetics below 5.7, maintaining a healthy body weight, which includes following a heart-healthy diet and exercise program, and to aim for a normal BMI, which is between 18.5 and 24.9, and also managing stress, which some suggestions include Tai Chi, guided imagery, meditation, or yoga. Following a heart-healthy diet is suggested as well. There are many heart-healthy diets to follow. Some suggestions would be to eat more healthy fats, which includes raw nuts, olive oil, fish oils, flax seeds, and avocados, more colorful fruits and vegetables, high fiber cereals, high quality protein, and organic dairy, eggs, skim milk, or unsweetened yogurt, and to eat less trans fat, which includes deep fried foods and fast foods, packaged foods, especially if they're high in sodium or sugar, white or egg breads, sugary cereals, refined pastas or rice, processed meat, bacon, sausage, or salami, and yogurt with added sugar or processed cheese. It is also suggested to get physical activity. The minimum amount of moderate activity suggested is 2.5 hours per week, and this equals about 30 minutes a day, 5 days per week. Some suggestions include brisk walking and cycling, aerobics or swimming, or to get a minimum of 1.25 hours per week of vigorous activity, and this includes 25 minutes per day, 3 days per week. Some suggestions are jogging or running, fast cycling or cross-country skiing, or anything a person would enjoy and maintain for the minimum amount recommended. So in conclusion, heart disease is the leading cause of death in the United States and the leading disease reported in the community of Sheffield. This community can prevent or reverse heart disease by stopping or never starting to smoke, taking steps to lower their cholesterol, checking blood pressure regularly and aiming for less than 120/80, controlling diabetes, maintaining a healthy body weight, managing stress, eating a heart-healthy diet, and getting adequate amounts of exercise. Thank you.